go vote. Because we dey see wey person don take push now, na sleep e dey sleep. By the time do dey clean, people then they go fetch for wetin dem dey get, then still team up dey sleep. You see person dey team up.
So people dey see exactly, we dey see people in the sleep.
Okay, fam with them, that's not being a discussion on drugs and kush. Now we country Sierra Leone. As we listen to that, the complete interview, it in our Facebook page, it in our YouTube channel, Salone Discoveries. So we don't listen to them quite for a stretch time so that we will debate on them or we'll talk about them or we give your own input as to what we think about this particular discussion. Now, one of the interviews them way being really, really, educative for the nation, for citizens them, for everybody we get the opportunity for listening about drugs in our Sierra Leone. So as we continue for discuss or highlight and find a way how we could disseminate the information, whether not through comedy or try for call the attention on stakeholders, them call on citizens, them call on practitioners, them where they, really in charge and for ensure say we create some form of support group. We create some support of, highlighting the facts about drugs, what drugs they do to you as an individual. When the second part of this interview, Abib T. Kamara, where we interview and one for tell him Boku Tenki for an insight on this particular topic here. So now something we don't address and we'll continue for address them because we believe, say, we youth them get for be destroyed if we not do something about it because of kush. Something where he also highlights, parliament, they talk about policies and procedures them now we country. How well then they address this particular problem or this particular endemic now we country Sierra Leone. Waiting at the measures them they don't put in place for ensure say if them find you with drugs on the street, we're not to prescription drugs. What then they do? What are the interventions them where we get currently for ensure say we will keep we youth them safe, keep the citizens them safe because that person where they take drugs, go drive you, in a car or ride you on an Okada. There's a possibility say the only loss in life, it creates other accidents them where go hurt other citizens, them, the passengers, them, and even people that wait team up now the road because what it create, it cause dizziness, it cause drowsiness, it cause hallucination, it cause so many different mental health symptoms as well as problems them where they make that person they think straight, they do the right thing. Now make some of even the prescription drugs them where they don't prescribe them for you, then they clearly states say, do not drive heavy machinery. The reason being now one of the things that really happen. Think about it. If you don't get a surgery, whether they give you narcotics, whether not oxycodone, morphine, or any of the opioids, them, how it make you feel? The pain they go away, but it create other things them for you. And in many cases, they see you, then they give them drugs or then medication, prescription medication, them at a very limited amount. Now, so for example, in the United States, where you go now the emergency room, if then they discharge you because you get some kind of excruciating pain where they're not able for take care of with medicine that when they give you now the hospital and then they send you home. Then they tell you, say, the limited amount where the state actually wants for make you get. Now, 7 days supply. Meaning either they take them every 12 hours or every 6 hours or every 8 hours. And this now controls substance because so many people don't lost their life because of that. In that, let me tell you, where this prescription they are so where we the right time now the hospital. You then look at a site for find out when last this person get a prescription of this particular medication. You dey go na that system, enter the patient information for find out if them don't prescribe this medicine. And it not only left to you, the prescriber, the patient, they go back na the pharmacy, say they get the drugs, and the pharmacy self get for look that system where they call the health commerce, and they call an I-stop. I-stop meaning you want to stop any drug overdose where it can na you face or where it can na you encounter. So most of the time when they write prescription, that's not things that what they do. So if the patient we don't get the medicine, then they release that medication to that patient. That's not because now everybody they come on board. Now the health system, whether you're not a prescriber, whether you're not a pharmacist, and family members, they also get for be educated. Because we get people that with the drug addiction, and then people that also need help. And communities, them, stakeholders, them, people that were involved in the care of the patient holistically get for be involved, get for do their own part. So we the hope and pray, see, we country, no matter how little we are, no matter how we not get enough resources for put some of them measures them in place, I believe Lord begin the model from things like this, we will keep we youths them safe, we citizens and safe. So as we call on government on everything, because government now they control the country in finance. Now they know how to allocate funds them, and Congress for ensure say them funds they also they allocate them to the right places. So we call again to the Ministry of Health, the pharmacy board, parliamentarians, the government, the president, and anybody who go able to make a difference, even community stakeholders, citizens, who they call on una all. If you know say somebody get drug problem, be that advocate person. We go now say, hey, this they go on now so. And if you're not family member, not sit down and watch your loved one go down the drain. You can do your own part. I just give you an example of how and they run Salone, not to America, not to Europe, not to any other parts. We know that. But I believe say waiting we learn, it makes sense for Lord. We bring them now our own country and Lord, we talk about it and see how best we can do your own part as citizens, as people them living in the diaspora, but as Sierra Leoneans, most of all. So please, let's say hashtag say no to drugs in Sierra Leone. We need youths, we need adults, we need them for grow, we need them for be people them with themselves can contribute na society. Now that na the way forward for let we country grow. This na me take, and now one of the things them where you go hear me talk in a different light. Now I want to read few comments them will come in. Sylvia, they say, honestly, doctor, this country, now only God, this help we, but medical system really poor. And that's the truth. How many people them where they out there, where they go do free checkup on an annual basis, even one time, waiting with them most of the time they where things them happen. Now, where would they say, oh, I don't go take drip, I know they feel well. Then check the one thing where they go tell the person, say, you get typhoid, you get malaria. We know say that then our country. But what about the other medical health problems then? Like HIV, AIDS, like hepatitis. Would they screen for them thing there? And what will screen for them? Are we creating a stigma now the community, or are we creating an education where they tell this person, say, if you are HIV positive or you get AIDS, there's medications now where person have one medicine or one tablet, then they take Biktarvy, for example. People then they take this now combination drugs, highly active antiretroviral drugs. Them medications then we possibly get AIDS or we get HIV, they take. And you can see if they continuously they take their medication as prescribed. Then people that can be at a point where the viral load, they not even detect them. They not even detect the viral load because then they take their treatment. Remember, where AIDS it become so stigmatized around the globe. Now it's not like that. People then they will get AIDS, then they live with them, then they do their own part. So Lord create sensitization, Lord create free screening. You where they out there, if you don't know your HIV status, my teaching point on that, please get yourself screened. And then do that every 3 years. Not so that not the only thing we forget yourself screened out for. When our HIV AIDS, but also screens for, gonorrhea, chlamydia, syphilis. These are some of the other sexually transmitted infections where they out there, where some man don't know about. Syphilis, they cause so many different things, them, as well as gonorrhea. If you get pregnant, then you pick in, that unborn child, then born up, and you get gonorrhea. Trust me, there's risk for blindness for that child there. So many things and they where it comes to just preventative health medicine. We talk about drugs, but we talk about infections also, where a big being highlighted with HIV. Now in interview. So please, if you don't watch this discovery, and you can watch me or listen to me right now, I'd encourage you for let you go. You watch that day and listen to some of the health discoveries that we have done do on sexually transmitted infections. So this is my own teaching point. And if you get anything for add, please feel free for Adam. Lord create awareness. Lord create a way for make we country, we citizens then become healthy. If they are healthy, trust me, we'll see a change, we'll see development in our country, Sierra Leone. So additional comment will come from Sylvia. I want to say thank you for that. One, and you too for comment. In terms of we medical system, sometimes I ask myself, who is to blame? Government or the staffs? Because it's really not easy, Sylvia, they say. In this particular light, I think both could be blamed because we all get our own role and responsibility for play in the development and future of our nation. That's not me usually quote where I always highlight. As a government, if we create that environment, that enabling environment, ensure funds them, they go into the right place system where for improve we country Sierra Leone. Followed by you, the citizen, or you, the staff, where you don't take an oath. You want to treat people them holistically. You educate them on the risk we involve for unprotected sex, for example, and drugs and side effects of medications them, where this they go to not just only to the physician, the nurse, or the pharmacist, then you, the citizen, because we know we literacy level in the country. So let's create another way for talk to with people them about safe sex practices. Using protection, especially when you don't know this person, you don't know what he get. If you want to live with this person, why not let them be your lifetime partner? Do some screening. Back then, there is no way to do these things, but now you get the opportunity for let you screen for no say this person, get any genetic condition like sickle cell, for example. If I know say I get sickle cell, or I know say I get sickle cell trait. So then thing they are so very important for Lord we begin they wise up. Wise in a sense, Lord we continue for educate with different friends and families them. If you hear something now where you know say important, please disseminate the information out there to that you fellow brothers and sisters and friends, family members. And we continue for do that and ways in how we go continue for do health discovery, health talk. But most of the time, we not can do am more frequent because we dey see say people then they spend more time on other things than excitement about entertainment. But hey, in order for let you really engage yourself in those things, you really have to be healthy. You know, if you're not healthy, you cannot do nothing. Today, I'll be talking to you. I don't know, am I going to be here tomorrow? Same goes for you. So with that, we'll find out. We'll know exactly what's wrong with we medically, you know, on things them. Just check, go check. You know, let them do your blood work. Your kidneys them okay, your liver them okay, you don't get no infection where they need for treat. Because when they find out about something at a very early stage, the chances of cure is greater than when they find out about something at a late stage. That's now message we add on the talk on cancer prevention, for example, and any other health problem, diabetes, high blood pressure, liver disease, anyone. So they're all there now with Discovery Channel, Health Discovery, multiple of them we have it on do on, and I they continue for talk on them in the Discovery summary. But I will hold on day and we take with Discovery now to, you know, we entertainment Discovery, because now then to then day we been get this week where we been highlight. But we'll continue for promote other things them way we do as a company, as a Discovery team, and then foresee what else we can offer to my brothers and sisters them. Una way they join me, I want to say thank you. I hope what you hear from me today came before take that news to that your brother, that your sister, that your friend, that your loved one, and Lord continue for saying no to drugs now we country Sierra Leone. So I did take this and bear with me as we get for try for turn this to the next